we were told based on the science that masks are for protecting others,
Yep.
and it's not necessarily about your personal feelings. If you're in a confined space, how when you're recommending, how are you going to ensure the messaging from public health for the sake of public health is correct, so that people know when to wear masks, and what would you tell your family or your friends so that they know, cutting through all of the pageantry of a press conference, how would you tell them, like a patient, when and when not to wear a mask?
Yeah, so right now it's mandatory, so the question is relevant, but mostly for when it will be out of the scope to be mandatory, which is supposed to be not later than mid-April. And if it's so, if it's getting better, we'll probably recommend to the government to fix the date earlier. And at that time, and you're perfectly right, the mask has not been conceived to protect ourselves. It has been built to protect the other. This is why we're using it as health workers, to not to be protected by the patients, but to make sure that we're going to protect them. So the question is quite irrelevant, but it's very difficult to continue to argue to everyone to wear it because some might be at risk. The issue here is that with numbers that is most probably around 3 million people, Quebecers have been so far infected by coronavirus, and especially the Omicron one, and that most of the people have been vaccinated, and especially the persons that are at risk. The level of risk to be contaminated again by mid-April, if it continues to go very well, will then be very low. So it will be the expression of a personal matter to decide if we wish to continue to wear it or not, even though it's not clear that wearing it will protect us of any contagiosity. Of course, there is still possibilities to be infected even though you're wearing it, but it will lower your personal risk. So this is where we're going. And why are we saying that it's going to be no later than mid-April? Could it be right now? It depends on the volume of hospitalization. So if the volume continued to get down, it would have been because the level of Quebecers that would have been infected so far would have been greater than 3 million people. So it might be 4 million by the end of March. So with that in mind, the relative risk of being infected will be quite lowered. And of course, for some persons that are patients with cancer or very complicated diseases and impacting their immune system, they might decide to continue to wear it or not to get in a crowd where there are a lot of persons that are not wearing it. So this will be a matter of controlling their own risk. And we'll try to be really clear about that, and we're trying to be right now.